I'd kind of ask her, because she might be feeling hopelessness, she might be feeling hopelessness about the termination, maybe not so much about the main issue why she's come to see you. So you'd sort of, but you'd be considering whether or not her issues with the termination affect her insomnia and her stress and her anxiety and that sort of thing. Yeah, definitely.
Responsibility. That's the responsibility one, yeah?
Yeah, that's the one we're just talking about there. Yeah.
With age, Matata, just because she's got the insomnia, you can't shut her mind down?
Yeah. So Matata, we talked about that monkey mind, that those circular thoughts, that machine gun brain. That certainly can be a reason why a lot of people have issues sleeping. It's always a good one, I think, for anything that has to do with the head. Headaches, insomnia, head injuries, any kind of issue with this area, and with the headaches and that insomnia certainly being appropriate there. What else have we got? We've got everything. Got everything on my list. Has anyone got any thoughts or anything else that they think could work there? You guys are pretty good at this, eh? Cool. So we'll just talk a little bit about making up the essence bottles now, and I'll talk you through what will happen with the case that you guys do. So I put this quote here from Bach because it just really sang quite loudly to me about helping you to get to know yourself through the essences, and also that they come from the most natural place, that they're very, very natural, and they can help you get to know yourself. So as you go through your studies too, you'll begin to learn a bit more about empathy and active listening. So empathy is about relating to a person but not absorbing or taking on personally what's going on for them, which I think when you're studying to be a naturopath, you're the sort of person who does care about others' well-being. You want to help people, right? So, but the flip side of that can be that it can be to your detriment sometimes. Emotionally, you could, compromise your professionalism because of that desire to help people. So thinking about empathy and how you can apply that in the clinical situation and still be supportive, but not let that person's situation impact you negatively. It's something that you develop and you learn, and something that's really good to talk to other practitioners about. So if you can get a mentor practitioner in your area, it doesn't have to be a naturopath, that's a good start, or somebody they might be a physiotherapist or a massage therapist, or somebody who works with people on that personal level. Even hairdressing and beauty therapy, that's quite a personal sort of situation as well, where people can hear personal things about people. So that's empathy. So learning the difference between that and sympathy as such. And we've got active listening. So that's a fancy way to say that when you're questioning people about their emotions, you want to get really, really clear so that you can help them the best, yeah? So you might rephrase back to them what they're saying. So somebody's come in and they've explained to you their situation. So you could say to them, so just to clarify, you're telling me that you're upset about, or you're dejected, or you've rejected feelings about this situation. So you're sort of rephrasing what they're saying to understand it deeper. And often, I remember doing some activities with practicing active listening and just being quite surprised how you can misinterpret things just in general every day, with people you live with and stuff even. How you can misinterpret things based on your own experiences and your own perceptions. So active listening is a really good skill to verbalise back to the person that you're questioning about the specifics they're feeling. So making up a dosage bottle. So you can use up to 8 first light essences in each bottle and 6 of the bark flowers in a treatment bottle. So that's the correct answer, that's the tip that will give you as far as NCNZ is concerned, but there are a lot of practitioners who will use up to 11 or 12. So those combination essences with other essences and this kind of thing. So to keep it simple, we stick with 8 as far as it goes.
You said 6 for bark flowers. If you mix the 2, would you bring it back to 6?
I've never mixed the 2.
So you wouldn't mix the 2?
Oh, I don't see why you couldn't, but I think it'd be more synergistic and more complete and supportive. Yeah. If it was sort of, well, I've never thought of that. So it's the way that bark found that they work and resonate the best, is having that 6. 3 drops of each essence of the first light. For bark it's 2. You can remember the 8 and 3 by the model of Te Wheke, the octopus. So octopus have 8 tentacles and they've got 3 hearts. So so that's how you could remember the correct dosage for your studies. So at the end of your studies, a couple of years from now, you'll 3 years from now, wherever you are in your enrolment, you'll when you have your assessment, when the client comes in and you take the case, you get the opportunity to make a flower essence blend for them. So remember the octopus, Te Wheke, 8 essences maximum, 3 drops of each one. So basically you've got your treatment bottle. So you put your liquid in there. Some of these are pre-filled, and then you add your drops into that. So probably what a good I'll explain what we're going to do with the case taking first, and then I'll get us up the back and I'll set up everything so you can just go from making your treatment bottle. So what we'll do is get you guys to pair up. I think there'll be a group of 3 because we've got Julie joining us today. So what you'll be doing, you've got 20 minutes to take a consult. So one of you is the practitioner and one of you is the person who's being questioned. You can work together by all means to come up with a combination, or you can do it solely that practitioner-client situation. You can feel free to move around the room if you want to sit somewhere else and do that.
Sorry, I was just asking the treatment model of the side vinegar because I don't do alcohol. Can I use that?
Yeah.
That's fine.
Yeah, I've got the option, and when I take everything up the back and set it up and show you what bits are what, I'll explain to you how you can do that. Yeah. So you've got 20 minutes to do that with that consult, and then or 15 minutes to do that, and then you've got 5 minutes to make your bottle for your client. As long you can make your own bottle or your client's bottle, as long as you make a bottle. That's what we want to see.
Is that 15 minutes to do just one of you, or 15 minutes
to do one of you? Yep, 5 minutes to make the blend. So half of you will make the blend, and then we'll have that swap over time where the client then becomes a practitioner, and then you make the blend as well. Because if we all do it at once, it's a little bit too much going on around a small area, and it's more efficient for your time if we split it into the halves like that. So I'll take this up with all the bits up the back there, and if I can get Julie and Anne-Marie to clear that table off, and I'll set up and I'll explain it to you.
Is that okay? Do you want to go first?
Yes. That's good. I'm just Would you like a
On the 9th?
and come around here and have a look. Have a look at what you'll be doing. Store this way. Yes, so store this way up. Good observation. So the reason that you do that is because in this box, here's all your treatment bottles, all your stock bottles, sorry. So if you store them flat, the alcohol, if it's inside the dropper, will degenerate this rubber and they can taste a bit weird, and it's not what you really want in the blend that you're making for someone. So always make sure that they're not lying flat in a store. It's okay for a few minutes, but not long term. So those are your first light, and these are the bark essences, if anybody wants to use those. They're all alphabetical order in there. So if you can use the stock bottles that are in these boxes rather than the ones over here, these are the ones that are extra for when these run out. So if you need to open another one, just let me know so I can keep track of it. Cool. So here is the base that is non-alcoholic. Here's the boozy one. There's 10 that are pre-filled with the brandy. So just to save us time. So these little beakers are what you would pour the base into before you put it into the treatment bottle. Just stops it getting everywhere.
The brandy and the water.
Yes. So you've got 200 mils brandy, and the rest is water. And that's 1 litre. Yeah. So that's already mixed up.
So that you just put on 25 mils of that then? Yeah.
So you'll see how, be careful when you pick these up because the lids aren't on properly. So don't, if you pick it up by the lid, it could fall over. If it does, no big deal, but pick it up by the bottle. So you'll see that I've filled it up just under the shoulder of the bottle, because when you put the dropper in, it'll displace some of the liquid. So, and you want a little bit of a gap there. So when you make your selections, it can go a little bit like this. So, and it could be a bit tricky because a few of you will be making it at the same time, but you select all your numbers, get them up like that, and then put your 3 drops in, and then lie it down so you're not doubling up. You can get a little bit, if somebody distracts you, you can often, did I put that in? So that's a good way that you can make sure that you're keeping track of it. Or have a list crossed off on the piece of paper. Cool, so that's those. Now, these are your labels, so you can each take each pair. Yeah, there they are. So a legal requirement for any remedy that you create is that there has to be a label on it. It must have a person's name and the date and what the remedy is and the dosage instructions. Cool. So that's easiest to put on after you've put it all in there and screwed on the lid. Then you can put the label on. Works a bit better that way. Saves you trying to write on the bottle as well, so you write on the label before you put it on the bottle. Now here's the cards here if anybody wants to use those for selection. And I said before about if people want to make an extra blend for their family or their friends, then you can do that as well. So and this is just the form here that you fill out. So it's got, if you just put your name, you don't have to worry about the other stuff because we're not posting anything to you because you're here. So just write down your name and the numbers of the essences that you're using, and then you can take that to Tracy at reception and pay for that. Yeah, $9 each. Also, what else did I need to say something else about that? Is everyone clear on how you can make the essence blends or make the requests when you aren't at the college? Get them posted out?
Not really.
So you can do that by getting in touch with Natalie. She'll be taking over the dispensary when I go, and so you can email her. It's best to have it in writing so that we make sure we give you the right blend. Sometimes it's hard to hear the numbers on the phone or on a message.
Oh, so you create your own blend
Yeah.
and then just request it?
Yeah.
Rather
we
than
can send it out.
talking with like Saturday and coming together with one, what do you think?
Can't quite hear you.
Or like, you know, like if we were talking about what I might need and then you'd come up with some stuff, as opposed to that I'll just know and ask
Yeah, either way. Yeah, if you
Oh,
want to
yeah.
have a discussion with the tutor about the selections you'd make for yourself or a client,
Oh,
then you can do that too. Otherwise, yeah, go for it. You know, make up the blends that you would for your clients, and give us a call and we fill this form out on the phone with you, so we can do credit card payments or debit cards, and they get processed straight away, and the courier parcel gets sent off the same day, or you can deposit into an account, and it can take a couple of days to come through as a payment. But yeah, so there's that option. You can put up to 4 bottles in one parcel. Yeah, $3 delivery or $3.50 delivery, and $9 if it's rural delivery.
I have a question. So does that mean once we leave here, we can have people who want to come and ask us questions and whatnot, we go through the naturopathy case taking, and then we can give them advice on diet, on their nutrition or whatever that needs for their, because they would have done their food diary, plus we can give them that. So it's like we can officially do that once we've done it.
Yeah. You just can't say you're a first light New Zealand
Yeah.
practitioner.
Yeah.
You do need to let everybody know that you're a student
Yeah.
as a legal obligation.
And do we send, like, do we get you guys to double check what we're thinking?
You can do if you wanted to start with, but you know, they're really safe. That they can be. If it's not going to be something that's appropriate for a person, they won't necessarily get any benefit from it, which is why I suggest to people always focus on those negative characteristics rather than the positive. I'm all for focusing on the positive, but in this regard, focusing on the positive to bring more of it in doesn't necessarily work. They don't really work that, in my mind, anyway, they don't really kind of work that way. It's more about what's a problem, what needs balancing in that respect. Yeah.
So going from that side to bring it back to there.
Yeah. Yeah, so there's some extra bottles down here. I'll pop them on the table. And the other thing to remember, when you screw this lid on, it's a lock cap, so you want to feel it click or you want to hear it, so that when you're moving the bottle around, it's not open. A lot of people, once they've put their selections into the treatment bottle, like to say a karakia or a prayer or some sort of intention into that. Other people can be quite happy just hand it over. That person can do that if they want to. Also, when you're putting the flowers in, the stock flowers into the treatment bottle, Franchell suggests that people say the flower's name, etu, 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 made of flax, for example. And so etu, etu, etu means stand forth, be strong, come forward. It's inviting the flower to be the best possible medicine it can be for that person. So if you want to do that, you can as well. If not, totally up to you. Yeah, so booze ones, non-boozy, labels. Yeah, you guys keyed up with your consults? Yeah. Okay, so you've got 15 minutes for that, so about 1:45, we'll get the practitioners to come up and make their bed.
So for us, we have 3. If you want us to cut
Just
it down.
cram it in as much as you can. So we can just